Hi, Dr. Chahal. It's so good to see you. How are you?
Hi, Dr. Ravi. I'm good. Thank you. How are you?
Very well. So, what time is it are you in India or are you in the States right now?
I am in India. It's 11 p.m. and
Oh,
we're
wow.
celebrating Diwali today.
Wow, what's Diwali?
Diwali is called the Festival of Lights. And when we date back to history, it was when one of our Hindu gods returned from an exile back to their home city. Yeah. And we
Okay,
celebrate that. Yeah. A lot.
interesting.
Yeah.
So, let's begin with your interview. Uh, Dr.
So
Chahal. What do you prefer? Do I call you Sahaj or Dr. Chahal?
you can call me Sahaj.
I hope I'm pronouncing your name correctly.
Yes, yes.
Perfect. So, how would you describe yourself? I usually try asking people what are the three qualities that describe them the best. So let's just start with that.
I would say I could use the words helpful,
Hmm.
sincere, and calm, which is also what my name Sehaj means.
Wow. Okay. That's interesting. Okay. So helpful, calm, and do you wanna what
Yep.
else?
What else would be empathetic and compassionate?
Pretty cool. Nice. Okay.
Yeah.
Moving on to the same front. Is there any weakness that you identify in yourself or anything that you would want to be better at?
Yes, I do believe I find it difficult to say no to people or situations. Sometimes I may not be willing to do something, but with the fear of hurting the other person's sentiments, I do end up saying yes to them. Having realized that, I believe that now I try to be more mindful and also keep my interests in mind. And I do believe that those people who love me would love me the same, even if I am sometimes not willing to agree or do something which they'd like me to do.
That's a great realization. Sometimes some people have that much later. I'm glad that you can say that about yourself. Um, I had another question for you. Especially knowing that you're probably gonna come to another country, right? Did you face any challenges when you started working according to the American healthcare system, or do you think you anticipate any challenges while you'd be here?
I believe there are certain differences for sure when we compare it to my home country. One being the EMR system.
Hmm.
Our system back in India is different, but I believe my electives helped me be introduced to that system, and I had the opportunity to learn about different EMR systems ranging from Practice Fusion to Epic as well as eClinical. And I believe I do have a hang of it, and I shall learn more about it as and when I hopefully begin residency.
I'm sure that's nice that you've had an experience with different kinds of EMR systems.
Yes.
Sure, like first year, especially the intern year, the first few months are hard, but we've had residents from across the world before, and they usually get the hang of it pretty soon. It's always nice to have had that experience during your electives. So I'm glad that you've had that. Uh, the other question is, I would definitely like to know a little more about your hobbies or interests, if you would be comfortable in sharing any that you have.
I'd love to. I really enjoy Urdu poetry, Urdu script writing. I believe it's one of the most beautiful languages ever written.
Mm-hmm.
And I had the opportunity to learn to write the script on my own during my third year. I enrolled in Urdu writing classes,
Mm-hmm.
and it was one of my most memorable experiences because I happened to be the youngest student there.
Wow.
And my classmate was also a man aged 70.
Wow.
And we would have people coming for the class after their office hours. And it was just so much joy to be united by the love for the language we all had. And it
That
taught me that it's never too early, or it's never too late to actually begin learning something new.
you'll definitely see that happening a lot in the United States. People are always changing, learning new things at the ages of 50, 60, 70. So I think very rightly said. And one thing that really intrigues me is the fact that you know how to write it. A lot of us like know how to understand it, read, speak in it,
Yeah.
but writing is absolutely a great skill. It tells me a lot about your determination, your hard work, your persistence. So great job on that.
Thank you.
One thing that so this is one of those questions that I've seen a lot of residents be afraid of. It's a behavioral ethics question, but I'm sure like you'll be fine with it. So, how do you think would you respond in the following situation? If your senior on the same team interrupts you in front of a patient, how would you think you would handle that?
I would initially begin by listening to what the senior has to say.
Mm-hmm.
And if what they are saying is what is the right thing to do for the patient, I would do that. And if it is something which in terms of patient care would hamper the care for the patient, then I would talk to the senior as to why we must not go with that intervention in particular. And if I believe it sounded disrespectful or anything of that sort, I would later on have a personal conversation with the senior and sort out any difference which we may have.
Well answered. It's important to remember that sometimes things, how much ever ideal you expect them to be, cannot make sense with reality. And there are situations which you do not anticipate, and it's important to not react in front of the patient, especially. And yes, because you are on the same team and people can have difference of opinions, it's important to at least have tolerance and a respectful conversation later. So, well answered. Also, how do you think you handle criticism in general?
In general, I believe I do listen to what the other person has to say.
Mm-hmm.
And not everyone or everybody's criticism, I take it to my heart.
Mm-hmm.
But in general, if there's something I believe I should work on, I do take that into consideration and then work further on.
Okay, great. We like to like call it opportunities to improve nowadays, right?
Yes.
Um, so
Right.
I don't know
So.
what to feel about that, but sure. As long as most people take it that way, that's a good thing. Okay, one thing, and before I give you the opportunity to ask me questions, would be tell me one thing that I've gone through your CV, I've gone through your lovely personal statement. I think I know you, but I would really want you to tell me something that I probably might have not found in your CV or something that you're really proud of. You want to tell me.
Something I believe which is not in my CV is that while this journey is a marathon, I really want to help people who are with me in this journey.
Mhm.
Even though I am still a part of this journey, I am trying my best to provide as much knowledge as I can in my capacity and experience to all those who I believe could benefit from it, because I feel this sense of contentment in being there for someone.
Great. I think it's always important to learn what you learn, but also give it back. I think your beliefs are similar, and that makes a lot of sense. It's important to give it back. Uh, I mean,
Yeah.
whatever we know is something that has been handed to us by someone else. It only makes sense we pass it along, right?
Yeah.
So that was lovely. It was lovely to know you. I really hope, even if you don't match with us, you match at a place which makes most sense to you. And I'm sure wherever you go, you'll be a great candidate. You'll be an asset to the place. But before I move forward, I would love to offer you the opportunity to ask me any questions if you have any.
Yes, I would like to ask if there were any changes made in your residency program after your hospital received feedback from residents.
So I'm really proud to say that especially our program director is very receptive to what the residents' feedbacks are. I would like to give you an example. Like we had a clinical schedule where which were 4 blocks, and like the residents just 2 years ago suggested like let's just have these 2 weekly blocks, especially for them to help us with the difficult ward rotations and stuff. When we made that change, for example, and the very
Mhm.
next year, they realized that no, this change wasn't working as well. And we went back and rechanged that. And I
Mhm.
don't think we can say that for a lot of places. But our program director is super receptive to how things can be changed. There's not a lot of delay, and at the same time it does not mean that things have to work. If they don't, we can always change them back. So that is something that I've felt, especially in the last 3 to 4 years. The wellness index, I feel subjectively is really high. Objectively, sure, we do have our wellness events, but it's important to also know if things on paper are translating to how people are feeling.
Yeah.
So all of that, and there are specific nuances which I'm sure the residents will have talked with you during the pre-interviews. But should there be any more questions, you can always reach out to me or the program coordinator over email. And I wish you the all the very best, Saj.
Thank you. Thank you. It's an honor.
Like you said, like you saw, this was a very different kind of an interview. And this is how most interviews would go, I would believe, about 70 to 80%, because it's a balance of me asking you the right questions, genuinely assessing would you be a good match to the program, and then also not making you unnecessary, like walking you along, trying to make you decently feel comfortable. And I genuinely felt like you were more comfortable in answering those questions. I felt you are more humanly expressing your answers to me. I'm sure you felt that yourself. And
Yeah.
part of it depends on the kind of questions we ask. So I did ask you,
Hmm.
like, tell me 3 qualities about yourself. I would say you should definitely have them on your points, like, oh, I am helpful, I am kind, I am XYZ. Like in my case, I used to have, I'm inquisitive, I'm a traveler, and things that I wanted to talk about to steer the conversation in a way. One thing that I can recommend you is, instead of just mentioning those qualities like helpful, empathetic, just give a one liner along with it.
Okay.
Like I used to say, I'm inquisitive, and I think that's one quality that has helped me kept going. That is the one thing that put me in love with neurology. I am kind. That is something I realized is such a gift to myself over the last couple years. So there's some reference to every quality that you're mentioning. I think that's a good way to have it
Yeah.
stick in the other person's head.
I was,
Regarding the weakness, I feel it's great to choose a weakness that necessarily does not come across as a negative towards you, and you want to mention that, sure, I identified something and I'm working on it, or I've worked on it, so that it does not act as an obstacle for you working at that program, right? Again, a difficult question is any challenges that you think you'll face in the US, because you don't want to answer it in a way that the other person does not want to take you, right? You want to say like there were challenges and I've done my electives, I'm so comfortable with EMRs now, right? That's a good way to tackle things. One thing again, I think, which you handle very beautifully is, tell me something that is not on your CV, because most things will be on your CV. You should be prepared to answer something that probably might not be, or maybe tweak something on your CV that you really want to talk about and hasn't been brought up in the interview. You want to get it out there, right? Behavioral questions again are not super easy, but I think you answered it very well. You want to make sure the ethics that you revised during your step 2, step 3, that's the core basics of it. Yes, sure, things in reality can be a little different from what things are on the steps, but you want to adhere to the same principles. You cannot retaliate. You want to be a person who's like, I'll handle the situation later. But at the heart of it is patient care. You cannot also be like, I'll let people do things because I'm the junior. You are as much a doctor, you are as much a person. You can have an honest conversation and come to the right opinion, right? So I think all of those things you handled really well. And again, I'll reiterate, you make sure that you ask a great question towards the end, depending upon what time you have, because that tells me how much interested you are in the program. So,
Hmm.
all in all, I think we had a great interview session. So, the three kinds of interviews,
Hmm.
a friendly one, a balanced one, and then an old school traditional interviews. That can
Yeah.
really dictate how you respond in the interviews, but you need to be on your A game at all times. And as you go through your interviews, things will become more comfortable. You can prepare for 30 to 40% of the questions which are standard, but 60 to 70% questions would be which you have to adapt in the moment, and that's okay. Just be yourself and hold on to your core values, beliefs that you believe in, because truth is very, very apparent through your eyes, even if it's a virtual interview, right? And I hope you had a great experience. If there are any
Yes.
feedbacks or any questions you have for me, I'm happy to help you.
Yeah. I had one question regarding the weakness thing.
Mhm.
Is it okay to mention the weakness I have mentioned? Because
Yeah,
okay, because
I mean,
somewhere
there's
I heard,
there's not a black or a white answer. Sure,
yeah,
that
yeah, yeah.
they can be
No,
better or not. What you want to
hmm,
do it is whatever your weakness is, you want to express it in a way that you have almost overcome it. And I think you did that pretty well, because there has to be an honesty when you're answering that question. You cannot, it's not a weakness like I don't show up on time, which is an absolute no, right?
yeah.
It's something that makes you human. And that is a question which is trying for me to understand you as a person, right? And it also kind of tells you like you can tilt it in a way, I'm always the most forthcoming person to help people. So it's a pro and a
Hmm.
weakness. It's a smart answer to give. Yeah.
Okay, okay. I feel like now I feel it's okay to do that because I heard somewhere that maybe this answer we should not give. So I'll stick to this one only then.
I mean, at the end of the day, it should be an answer that you feel comfortable in.
Yeah, yeah, that's
Absolutely, there's
true.
no wrong or right at the end of the day, right? But
Yeah,
it's been a
and
pleasure. Yeah.
I needed it to do this practice, otherwise like the nerves really get to you.
Yeah.
Also, I wanted to ask you if I was able to convey what I was trying to convey. Were you able to receive that the way I wanted you to receive it?
I think I pretty much could gauge a few things that I look as an interviewer are how you communicate, how charming is your personality, how much can you hook me onto, and do you really want to be here? Like, do
Hmm.
you connect with what my program is? Would you be a good match for this program? And
Hmm.
sure, that question is something you have had to do your research on your end, but I know my program and I can assess you, gauge you. So if you are someone who's interested in community outreach, you ask me those questions. If you're interested in someone in meded, you ask me those questions. And I think you did a great job. At the end of the day, I'm convinced that you are someone who's literally genuinely interested in internal medicine, and you genuinely care how you can balance your way around whether it is a chest pain patient, what are the basic steps of management, or they're ethically behaviorally based questions like in a situation like this, how do you see yourself? And I think you did
Hmm.
a pretty decent job there.
Hmm.
Depending upon how well you fit with the program, it's gonna be the final verdict. But
Hmm.
also don't be intimidated at the end. A lot of programs very rightfully say that we do not know if you'll match with us or not, right? We hope you the best. We hope you match wherever you want to, and that will be 90% of the programs telling it to you. And that's okay. That does not mean you are not going to match there. That does not mean you're going to match there. Don't let that intimidate you. Okay, just be on your best game at all times.
Got it. And also this question which I asked about the residents being
Mhm.
able to make a change, is it okay to ask
It's
that? Like,
absolutely, it's absolutely
okay,
fine to ask.
I think okay, okay.
It's
True.
absolutely fine. That tells me, and you use the right words. You use feedback. Feedback is a very important component here. Instead of,
True.
you don't want to change the program, you want to improve the program, right? So great
Yeah.
job on that. Perfect. I hope
Anything
this
else you
was an insightful experience for you and for everyone who will probably watch these videos. And uh,
definitely?
I I hope that we can help a lot more residents next year when you are on this side of the table.
Yeah, I'd love to be on that side of the table. Well, let's hope for the best.
All the very best, Saj. I'll see you very soon. Thank you, everyone.
Thank, thank you.
Bye.